So a couple more words associated with cysto, referring to bladder. Once again, we're talking specifically about the urinary bladder, but cysto could be any type of bladder that's in your body. A cystoscopy would be a visual examination of the bladder done with a cystoscope, an instrument to examine the bladder. I want to use the opportunity of these two diagrams here to illustrate something, especially when it deals with urinary tract infections. If you look at the cystoscope on the right, being the male urethra, you can see the length of the tube before it gets to the bladder. The actual length of the urethra is quite long. Now we're going to cover urethra in the next slide. So just understand that that's the portal that goes from the urinary meatus on the very end of the penis in this depiction. It goes all the way into the bladder. So it's the tube through which we urinate, referring to the urethra. In the male anatomy, the urethra is quite long. And if you look to the left, the urethra in the female anatomy is quite short. This is the reason for urinary tract infections. For a male, for bacteria to make it all the way up the urethra into the bladder, it's more of a challenge because it has more of a urethra to transverse. However, in the female urethra, it's about 1.5 to 2 inches long. This means that bacteria, given the location and the proximity to the rectum, bacteria can find its way into the urethra and up into the bladder and cause bladder infections. So certain types of hygiene can prevent this. Certain practices following sexual relations can prevent this. But this is the reason that urinary tract infections are far more common, especially in young females than young males. When you start getting into the more elderly years, there are quite a few male urinary tract infections too. Those happen for different reasons, and we'll get into that when we discuss male health. So, urethra. I've used the word a couple times already, so you're probably wondering where exactly does it fit in. You probably already know, actually, but nonetheless, we're going to cover it. Urethro is a combining form. That's a relatively easy one because it looks almost like the word we're talking about. Urethral means pertaining to the urethra. Urethralgia is pain in the urethra. Urethritis is inflammation of the urethra. Urethroplasty is a surgical repair of the urethra. And urethrocystitis is an inflammation of the urethra and the bladder. So you see it depicted here. Now we'll start for the whole diagram again in the upper right. The kidneys, it goes to uterus. There's at least 2 uterus. There's at least 2 kidneys. They descend down into the urinary bladder. You have 1 urinary bladder. And leaving the urinary bladder, you have the urethra. And that is the portal through which we void urine. Once again, you see the depiction between the male and the female anatomy here. One more clear depiction of the urethra passing down through and the length of the urethra on the male anatomy versus the length of the urethra on the female anatomy. And once again, that ties in directly to urinary tract infections. That short urethral distance is much easier for bacteria to transverse than it is for the male urethra, hence more urinary tract infections in young females. So I've brought up the issue of stones. As we've gone through, we've given you nephrolith and uterolith. So we're going to go ahead and cover some more of it here. Lithiasis is a suffix, you'll recall. It has lith on it already, which means stones, and iasis, which means presence, or not presence, but condition. We put them together, we have lithiasis. So it is possible, and I've mentioned this before, for suffixes to be combined into, if you will, a compound suffix that takes on even more meaning. So we have that example right here. Lithiasis, formation or presence of stones. Nephrolithiasis is the formation or presence of stones in the kidney. Uterolithiasis is formation or presence of stones in the uterer. And cystolithiasis is the formation or presence of stones in the bladder. So each one of these is problematic. Each one of these causes symptoms. Some are worse than others. So we see the kidney stone or the nephrolith, or in the drawing, if we look to the left corner, the kind of in the middle there's a picture of the kidney. Right there in the renal pelvis sits a kidney stone. That's completely blocking the function of this kidney. That cannot stay. It has to be removed or it's going to permanently damage this kidney. If it's big enough, it will not be able to descend down the uterer. It's just going to sit there and block the kidney. Nephrohidrosis is going to result from that, and that's a dangerous condition. You do not want to block the passage of urine from the kidney. So that's an example of a nephrolithiasis. Uterolithiasis is depicted in drawing to its left. So here A smaller stone has managed to descend down the ureter, and of course, it's, once again, these sharp, jagged edges, it's causing problems all the way down. And for these two examples of the nephrolithiasis and uterolithiasis, you're definitely going to be seeing hematuria, or blood in the urine, as a symptom, along with pain. When it comes to the bladder stones, or the cystoliths, you see those here in the lower right corner. They look a lot different. Because they're located in the bladder, and because fluid in the form of urine, essentially water, mixed with the other things your body's getting rid of, surrounds those stones a lot, smooths the edges, so they look a little bit more like gallstones, a little bit more like river rock. So the friction of the water and the movement through the bladder is kind of soften those edges. So bladder stones tend to be larger. They tend to be sometimes more problematic, tend to not cause as much damage to the inside of the bladder because of those smooth edges. If you did have a stone in the urinary bladder, a lithotomy would be in order. They would not use lithotripsy. They would not come in and try to crush it, because the urinary bladder is pretty accessible. So there's one thing about this word, though, it's a little bit tricky, and I want you to be aware of it. A lithotomy is an incision of an organ or duct to remove a stone. It does not mean incision of a stone. So if you were to look at this literally, you know, incision being tomy and litho, it looks like you're cutting the stone. That's not the case. You're cutting, in this case, the urinary bladder. They're incising that to remove the stone itself. And you see a depiction of that here. So it's done much in the way that they would do a cesarean birth. There's a small incision made. The urinary bladder is then sort of brought out of the body. It's incised. They go in and remove these stones, suture it back together, put it back in place, suture it back in, suture the skin back together. Now, I've just oversimplified the process, but that's what it looks like. The takeaway is lithotomy on this one is an incision of an organ or duct to remove a stone. It does not mean the incision of the stone. Okay, going back to kidney in our nephro combining form, nephrolithotomy. So we're going right back to the word we had in the previous slide. A nephrolithotomy is incision of the kidney to remove a stone. So here we have a calloceal stone. You see in the most superior part here. We have a renal pelvic stone in the medial part of the kidney. In the lower part, entering the urethra, we have an upper urethral stone. You're probably getting the gist here that the location of the stone it will determine its name. And so I gave you general terms before. Here, they're actually a little bit more precise. So now they're not saying that it's just, well, it's in the kidney. They're saying it's in the calloceal. It's in the renal pelvis. So you can get very specific with these terms and tell exactly where the stone is and pass along really useful information. So, process of urination, what do we call it? Voiding. So, when we urinate, we are voiding. And you see several depictions of that here. And this would be considered your urinary tract that's functioning correctly. So there's no blockages, no reason to think you can't urinate. However, when we talk specifically about inflammation in the bladder or the urethra, there are certain conditions that may prevent the urine from leaving the bladder. So the kidneys are functioning, and they're draining to the uterus, and the urine's making it to the bladder, but for some reason there's a blockage. It could be a stone, or it could be inflammation, and it's blocking the ability for the patient to void, which once again, you do not want to have urine retained in the body. The infection risk goes up tremendously. It's going to have a huge impact on the kidneys, and it's all around just a bad idea. So we have a process called catheterization. A catheter is a hollow, flexible tube. They insert a catheter into a body cavity or organ. So when I talked to you before about, putting stents in the heart, that's a form of catheterization. They put the patient out in a surgical setting, and they come in through the femoral artery and up through the aorta, and they catheterize the femoral artery. They catheterize the aorta as they come up through the heart, and they insert this small hollow tube in there so they can do work or take a look around or a scope, whatever it is that they're putting in, the process of catheterization. In this particular chapter, we're talking about removing or instilling a substance via catheter, and in this case, it's a urinary bladder. And this is the most common site to do catheterization, although, as I said, it happens in many parts of the body. So if you have a situation where the urethra is unable to allow urine to pass through, there are other conditions that might cause this. And when we get into male health, the sexual reproduction chapter that's coming up, we'll talk a little bit more about this. But catheterization is the way you're going to be able to remove that urine if the body can't do it naturally. So there's two purposes for it. First of all, we catheterize to remove substances, in this case, to remove urine. And other times we might be putting contrast medium into the bladder so that we can take a radiological image of it, an X-ray. So we're either taking fluid out or putting fluid in, and we're using it by means of the catheter. What you see here is a classic urinary catheter. It's called a Foley. You see it has a little balloon inflated on the end. That end would be lubricated. That balloon would not be inflated. That tube would be inserted into the urethra until it was in the urinary bladder. Then the balloon is inflated, and the reason for that is to hold the catheter in place so it doesn't come back out. When it has to be removed, the air is released from that balloon and it's removed. A patient may be catheterized for days, weeks, could be only hours. It really depends on what the situation is. For urinary retention problems in elder years, say someone 65 and older who can't retain urine anymore, it comes out when they don't want it to, some of those folks have a permanent catheterization. So they just have this catheter, they can insert it themselves, have a bag that straps to the leg and that catches the urine, and therefore they don't have to do other methods of capturing the urine. If we were going to instill contrast medium using a Foley catheter into a urine, we're probably doing something called avoiding cystography. And that's usually what processes radtex that we're involved in when we're putting a catheter in to instill the fluid. This is a radiographic exploration or examination of the bladder and urethra while the patient is urinating or voiding after filling the bladder with contrast medium. So that kind of gave it to you in the reverse order. What we do is we usually use a fluoroscopy machine. So we're making an X-ray movie. We put the catheter in, we fill the bladder with contrast medium, and then we have the patient urinate while we do the video of it. As you can imagine, this can be an awkward situation for the patient. Some people are, shy when it comes to urination. I've seen patients have difficulty passing urine in these moments because of that. They're bladder shy, as we like to refer to them. So we want to make them comfortable in doing so. And of course, we're doing this for a specific reason. There's either inflammation that's not allowing the urine to pass. There's a stone blocking it, perhaps. There's, God forbid, a tumor, or there's some other pathology. And all of these things we can see by putting contrast in there than taking pictures, because we can see then densities. If you take a picture of a bladder and there's no contrast in there, you're not likely to pick up much information unless it's a very large stone. However, if you have the contrast in there, even a very small stone would be visible. That's close enough to our 15 minutes. I'm going to pause it here, and I'll be back in the next segment, and we're going to talk about the contents of urine itself. So I'll be back with you in just a moment.